Welcome back. I'm joined now by Dr. Alicia Swink on behalf of St. Mary's Cancer Center. And today we're going to talk about Breast Cancer Awareness Month, which is October. So first of all, welcome. Thank you for joining us today.
Thank you. I'm really glad to be here, Katrin.
Yeah. And so let's start with, October is Breast Cancer Awareness Month. And this is something that predominantly affects women, but also can affect men, right?
Absolutely. And really, it affects everyone, right? Because everyone almost knows someone who's had breast cancer.
Yeah.
But we say, 1 in 8 women will be diagnosed with the disease at some point in their life.
Wow.
Much less common for men, but it does affect men. So we want to make sure they're aware of their risk as well.
Yeah. So this, you said 1 in 8 women, right? Is that,
Yeah,
wow.
yeah, I know.
So this seems to be a very common form of cancer.
It's the most common cancer in women for sure, and then second only to skin cancers really as far as prevalence in the female population in this country. So like I said, everyone is affected and everyone needs to be aware of how they can detect, prevent, and then if needed, treat the disease.
Yeah. And so then with detecting and prevention, what would you recommend for women to make sure that they are kind of keeping up with these detection practices?
Yeah, that's a great question. And the guidelines are differing a little bit between different organizations, but really every woman should have the conversation with their doctor starting at age 40 about yearly mammograms. And this is still the gold standard for detecting breast cancer in its earliest stage. And we really want to catch it early because, Katrin, if we catch it early, we go on to cure almost 95% of women.
Wow. And so then for the treatment option, I know that the St. Mary's Cancer Center, you guys are actually having an open house in a couple days, right?
We are. We're really excited about it. This Wednesday, October 9th, from 5:30 to 7 in the evening at the St. Mary's Cancer Center. We're having an open house to celebrate the opening of our new breast care center. I'll be there along with all of our other providers, and we are going to be available to talk with anyone who has any questions about breast cancer prevention, treatment, diagnosis, anything going on that you're wondering about. We'll be there.
There you go.
Yeah.
And so then for people who maybe are watching and wondering, okay, well, what does breast cancer look like? What are some symptoms that maybe people should be watching out for?
Great question. So usually the most common symptom of a breast cancer is there's not one. So that's why we use mammograms to detect them. But if they're a little bit more advanced, there can be a palpable breast lump. A self-breast exam can be used to find breast lumps, but that doesn't take the place of a physician-done breast exam, at least yearly, and then, like I said, the mammogram. Other symptoms can include changes in the nipple or in the skin. Anything odd or different about the breast should be brought to your physician's attention, and then they can take it from there to see if it's something worth being concerned about.
Okay, and like we said, with this open house, you can come and kind of see the Cancer Center for yourself, ask questions to physicians who are working there, and kind of really get more information about this because, it is an awareness month. We want to make sure that people are aware about that.
That's right. We want women and men and their families to feel very comfortable coming in to see us and ask these questions. There can be some stigma sometimes associated with cancer of all kinds, but especially breast cancer. And we want to take that away and make everyone know that this is a real problem with real solutions if we catch it early.
Perfect. All right, well, thank you so much for coming on today.
Thank you.
If you want more information about this, we'll have a link to the open house and more information on our website, westernslopenow.com.